Welcome to Direct Supply's Continuing Education webinar series. Direct Supply offers monthly webinars on a variety of topics throughout the year. The topic for today is the changing technology dynamics in senior living. My name is Robin Malik, and I will be facilitating today's meeting. Please note the information contained in this presentation is intended to provide general information, but not advice about certain regulations and initiatives. This is not intended as legal or other advice, and each situation may vary depending on the particular facts and circumstances. You should not act upon this information without first consulting with qualified legal counsel. Today's webinar will be presented by James Jansen and John Rydzewski. James Jansen is a technology product manager at Direct Supply. James works with customers, manufacturers, and a vast network of technology partners to understand and deliver resident monitoring solutions for all levels of resident care. His focus is to help customers improve their overall technology experience and deliver customized outcomes that improve care, streamline workflows, and reduce costs. John Rydzewski is the Senior Director of Program Development at Direct Supply. John is responsible for leading our technology solutions team and corporate connected solutions strategies, including the Internet of Things enabled products. And now, please welcome James and John.
Great. Thank you, Robin. Appreciate the introduction. And thank you all for joining us today. So we're going to get started with the changing tech dynamics in senior living presentation. And myself, I'm James Jansen, our product manager for technology solutions.
And I'm John Rydzewski, our Senior Director of Program Development and our Technology Solutions team.
Today's agenda will be going through 4 key points. First being the current state of technology that's deployed in senior living communities, followed by a game plan of how to plan, tailor, and select, as well as implement new systems and solutions in your communities. Then will be followed by senior living technology trends. And last, we will be talking about the future of technology in senior living, specific to IoT, AI, and smart buildings. So what is the current state of technology systems in senior living? Today, what we are seeing is a host of different systems going and making up one ecosystem, and as much as possible, integrating systems and solutions together. So commonplace technology that's in today would include nurse call systems, wander monitoring systems, AV and theater systems, notification and metric type systems, sometimes linked to your nurse call or other platforms, area of refuge, video surveillance, access control, and intercom solutions, as well as electrified door hardware. So all of these solutions and systems are coming together today to provide one technology ecosystem in communities. All of that's brought together by an overall structured cable or IDF, MDF build-out, which would be your IT closets. To get all of these systems to work together, it's important to have the right cabling and network infrastructure in place, and we'll get into that a little bit more in some of the trends conversation. But this is what we are seeing as commonplace technology in senior living communities. When we look at where is technology investment today and where is it going, we took a look at a Ziegler study, and in 2016 or 2017 they released a study where they had talked to and surveyed CFOs in the senior living space, asking in 2016 where were dollars spent on technology, and in 2017 what was planned technology expense. And the survey results are in front of you. Leading the technology spend was ICT infrastructure, which is essentially your Wi-Fi networking infrastructure. Most CFOs identified a need of needing better Wi-Fi and better network connectivity, and that by far, 81%, was leading the pack in terms of where investment dollars were going. Next was EMR and connected type of solutions through EMR, EHR, so mobile charting and those types of systems. Followed by access control and wander management. As you go through the list, you see point of care systems, next nurse call systems, and on. So this is a really good representation of where technology spend has been and where the plan is moving forward in terms of where dollars are going to go, systems that are making most sense for senior living communities today.
So today we're going to talk about 3 things and really understanding why are we talking about technology? There's really three big reasons. One is to improve outcomes. And what does that mean? That's both measurable clinical health outcomes as well as experience outcomes of your residents and your staff. What is it like for them to live within the walls of your community, and how do your staff like working at your community? Second is about doing more with less. As we know that there is great pressure on staffing, both on the clinical and maintenance side. We know today there's a large nursing shortage, and that's only planned to continue out into the future, and we'll talk a little bit more about that later. So how can you use technology to improve staff communication and ultimately reduce work for your maintenance staff, for the work that they're accountable for, as well as for your clinical staff and working with your residents? And the third big reason why we're talking about this today is really aligning with and then staying on top of technology megatrends that are going to dynamically change senior living. And as you think about this, we challenge you to think about your own organization and where you really fit in this. There's typically with any product adoption, there's the innovators who come first and early adopters after that. And then there's really the early and late majority, which really makes up the biggest chunk of folks and at what time frame they adopt technology. And last is the laggards, who are usually the ones at the tail end. And our assumption is that you're part of this webinar today because your organization either is in the innovator, early adopter, or majority section, or you want your organization to exist in one of those buckets. And so hopefully today we're going to talk a little bit about some of the technology trends that are happening in the greater world around us, and how are those starting to impact senior living, and what are some of the ways that you can start to get on board with them.
So let's talk about the journey it takes to purchase technology. It's become much more than selecting hardware and software that you like and have maybe seen at a trade show or seen marketed to you. What we look at in terms of solutions is really understanding a couple different phases. First would be an assessment phase, where today 83% of senior living corporations believe they're underinvested in technology. So if you feel like you're a little bit behind, most everyone does feel that way, so that's okay. But really understanding where you are today, where you want to go, as well as doing an analysis of what you have in your buildings. Where is the gap between where you are today and where you want to be 1, 3, maybe even 5 years down the road. And in so doing and taking a look at that, having a cross-functional team is going to be very important in assessing technology and where you want to go. A lot of times at our company, Direct Supply, we encourage people to pull in team members from nursing, from clinical, from IT, from maintenance, from administration. So really having a cross-functional group identify what are the gaps and where do we need to go, because all of those team members are going to play a very important role in defining what success is going to look like. Once you assess where you are, you begin a planning stage. And again, 80% of senior living corporations believe they're going to be acquired by someone who's more technologically advanced. So planning for, how do I get to a better spot? How do I get to a place where I have some advanced technology where you don't have to worry about those who are coming up on your heels or are there in a competitive state. Really understanding where you need to go to and how do you get there. So defining standards is going to be very critical, not only for the systems that you want to have, but also how those systems should work for you. Putting that game plan together is going to be critical so you can make sure you get what you want in your communities, and you also are going to be able to use that solution effectively. You also want to understand what is your decision process going to be. So understanding who's going to make those decisions and who are going to be influencers in decisions versus who's making that final decision is going to be important so you can move through the process quickly. And again, identifying what is the ideal solution. Where do you ultimately want to go? That's really the goal of the planning stage. Once you do that and the team feels comfortable with where you're at and where you're going, you understand how you're going to make those decisions, choosing a partner is going to be very, very important. And when we say partner, not only someone who sells systems or is a manufacturer of systems, but someone who could act as an integrator, someone who can act as an advice giver, someone who understands the technology industry as it relates to senior living. To help bring ideas, to bring best of class ideas and solutions forward. So understanding what a true partner does rather than someone who's promoting a specific product is going to be very important. At this point, too, as you're selecting partners, you as operators are going to be able to negotiate best pricing based on project size and scope, especially if you're talking about multi-sites or multi-campuses, and making sure a partner who understands that aspect of it's going to be important and who you're going to choose to go forward with on this technology journey. And the last part in really understanding and defining a true solution is going to be owning the product. Once all of these phases happen and you do a solution, owning the technology that's in your building is going to be critical. So what do I mean there? Talking about service plans, anything that may be ongoing, recurring for you, so training, any kind of software updates, any kind of maintenance. What is that partner going to provide? What do the systems provide for you there? Training is going to be a key component of that, making sure that your staff is continually refreshed in how systems work. You also want to take a look at how are you going to order replacement parts. If a pull cord breaks or you need a new ID badge, or a wander transmitter is, a battery life dies and you need to get a new one. How do you go about getting that? Is there an online portal that you can order? Is it easy to do so, especially if you are a multi-site corporation? How do you make that easy across the country? And lastly would be in-house support and maintenance. At the end of the day, you're going to own the technology that's in the building. So what are your manufacturers and what are your partners going to do for you to train your staff up to be able to maintain, service and support the technology that's in the building? Also identifying, as you go back to your assessing and planning phases, who are those key team members that are going to be responsible for ongoing ownership and making sure staff is comfortable with the technology in your building. It comes back to the owning bucket here, and what does that game plan look like for you internally, beyond what your manufacturer and partner is going to provide. So we'll talk next about some of the technology trends that we are seeing. Want to share that information with you. First, we'll start off with enhanced security. We've seen a big boom in the addition of electronic access control, video surveillance, and wireless lock type solutions to really round out a security program and portfolio for communities today. We've seen a very big improvement in investment in wireless connectivity. Back to the survey from Ziegler, the number one investment was in Wi-Fi and infrastructure. So that's definitely a trend that has been going for a while and is continuing, especially as more and more systems, as well as residents, staff, and family members are starting to use this network connectivity to a greater extent.
Next, we're going to round out by talking about going digital and emerging technologies. On the going digital front, what we're really talking about are otherwise manual processes or paper processes that are now becoming digital, similar to electronic medical records that are now obviously electronic and used to all be done on paper. And there's a number of other processes that are going digital that we're going to talk about. And the last is on emerging technologies, things like the Internet of Things, connected enabled products, artificial intelligence, and smart building technologies that are really helping to address some of the clinical and facility-based needs of our industry today.
So enhanced security. Here we're talking specifically about some new wave of technology that's coming in as it relates to access control and intercom systems, video surveillance systems, and wireless lock systems. These types of solutions have really come down in price point over the last 3 to 5 years, some as much as 50%, which has made it much more affordable and attainable for senior living communities that previously were maybe priced out of this market or had to look for different ways to provide safety and security, especially around doors and those types of things. So access control and intercom systems are really electronic means for you as an operator control the flow of people in or out of your building or certain areas within the building. You can now do that digitally. You can do that remotely. So if someone forgets their keys or loses their keys or loses a badge or a fob, you're able to remotely let them in, buzz them in, without the need to having to go to the site and do something like that. So it's really going to cut down cost, not only in the ability to access doors in certain areas remotely, but also rekeying. You get away from manual keys, physical keys, which can be hard to manage, and when a key does get lost, the rekeying expense can be quite high. So the goal of an electronic access control system is to automate all of that through an easy dashboard, software dashboard that can be accessed either through a computer station or a tablet or a smartphone. It also provides increased accountability. So you have an audit trail of who is going in and out of doors. You can see who used their fob or their badge or even their phone to access certain doors. If that's information you would need to know at any point in time, that can be documented as well as looked at in a report. When you couple that with the next bucket, video surveillance, you're enhancing the security platform even further. So video surveillance or video cameras is real-time or recorded view of what's going on in certain areas of your community. Typically, we are seeing those in outdoor areas, such as parking lots or main points of entry or exit from a building. But we're also seeing those in hallways, a lot of times around medication rooms, areas where there could be theft or situations where you need to have better eyes on what may be going on. Really want to deter undesired events, improve accountability, let people know that you have eyes on situations, and have that footage there for you to take a look at any point in time. Again, that can be real time, or that could be recorded, or it could be linked to maybe someone's phone accessing a door. Was it really that person at the door? When you put a video camera to that solution, you're able to make that determination quickly and easily. There's also a lot going on in the video surveillance space and video camera world as it relates to deep learning and AI. So camera manufacturers are starting to use cameras to do different things, especially when you look at facial recognition. There's a lot that's going on in terms of being able to maybe lock doors or act as an augmentation or enhancement to a wander management type system, or as an access control piece where your face would be your key and would allow you in or out of the building. They're also looking at fall management and building in fall analytics and intelligence into cameras to see if there is a fall or a slip or an incident. And just by seeing that in the plain view of a camera, the camera system itself is able to send notifications to family members, to staff, to anyone who's on the other side of that care equation to go respond to that event as quickly as possible. And then wireless locks. This is one that's really come on strong in the last year or two, especially in the independent living setting where people are going more for a hotel-style lock. So you're now able to download your key or have your key right on your phone. You can access doors using your phone. You can issue keys to other staff members, residents, family, as well, and their phone or their fob or their badge could be their key. But this would typically be at an apartment level or a condo or home level for a resident. And it, again, gets away from the manual key type of process that exists today. So it really simplifies door use. It gives much more access to more people, again, defined by who has rights and authorship of that door. And it's really bringing a modernization to that whole experience, especially when you look at how much stuff today is activated by a fob or a non-hard key like a car, that type of thing. It goes along with that same mindset.
Yeah, I think the wireless locking technology really speaks to some of the technology that's certainly pervasive, like James said, in hotels and other spaces, but where residents are increasingly going to be looking for that same type of technology to be present in the communities and facilities that they're going to want to live in and move into. And that's really an example of where, what's happening in the consumer space is really starting to impact what's happening in the senior living space, and with it bring a lot of increased functionality and ease of use for your staff and residents.
All right, next trend that we're seeing and have seen for a while is wireless connectivity. The need for wireless is there, and it's real, and it's more of a requirement now than a luxury. It's something that people need to have. You need to have Wi-Fi connectivity. People need to be able to connect to the outside world when they're in senior living communities. So understanding what network and Wi-Fi means for business-related needs is going to be very important, and especially as John's going to talk about some of the IoT stuff upcoming, understanding what is that key system infrastructure that's needed for those types of systems. So if you're implementing EMR or EHR, that tablet technology and that charting technology relies on Wi-Fi signal and a pretty robust Wi-Fi signal to be able to get that information back up to cloud-hosted servers. As you look at what is current state today and what is coming, there's going to be more and more of that type of technology. More of those systems that are going to be coming online are going to require more bandwidth or stronger bandwidth, more access points, and you're not going to be able to have gaps in your coverage. You're going to need to have Wi-Fi coverage throughout your community and even sometimes outside. So understanding wireless as it relates to business critical infrastructure is going to be very, very important, and a big trend where we see a lot of people making their Wi-Fi networks more robust. In addition to that is resident requirements. So your business use is not the only thing that's taxing your Wi-Fi or internet connectivity. Studies have shown that 67% of seniors are accustomed to high speed of internet when they're coming into your community. So the need is there, they're demanding it, and it needs to be high speed internet connectivity, not only for some of the business needs, but some of the things that residents are going to want to do. So streaming shows or movies, being able to connect, FaceTime and connect with family, loved ones, and those types of things is really important. It's becoming more of a need than a nice to have. And in there as well would be family members too. So you're going to have family, you're going to have visitors and guests. You know, if one of your seniors today in your community is connected, maybe there's 2 devices connected every day. When family members come and visit, you know, that could go up 8 to 10 to 12 different devices that are all connecting to your network, and they're all going to put high demands of network speeds and capability on your network. When you're talking about all of those types of things, and we're seeing a lot of IT teams get involved in these types of conversations, is an understanding of who is going to be the staff that's going to support that. Is that in-house? Is that someone that's going to be outsourced or out-of-house? And that would be part of your equation there as well. You need to take a look at how are you going to support that network? What does that look like? Because the questions and the calls are going to come in as to the network and being able to connect, and having an IT support team that can handle that's going to be really important. And lastly would be cloud solutions. There's a big trend globally where about 16% of just global organizations are moving to the cloud or software as a service type of mentality, where big expensive bulky servers are not being put on campuses. They're being hosted in the cloud, and operators are paying service fees or service contracts on a monthly or annual basis for access to software. So we're seeing a migration from what has been traditionally servers and big bulky servers and that type of thing on site, moving more to the cloud, where recent studies have shown that half of U.S. long-term healthcare providers today are in one way, shape, or form using the cloud. And that fits right in the trend that we're seeing in the consumer world and outside of senior living world, where things are moving to the cloud. So that is something to keep in mind and something to look at. Are there those opportunities for you guys to leverage and move to the cloud, where software and updates and accessibility and all of that can be managed for you remotely, and really offload some of the burden of what could have been complex technology for your IT teams in the past.
All right, thanks, James. And now we'll talk about a few trends around going digital. So there's a few trends that are happening out there, and we're going to speak a little bit around what's been probably the biggest trend for the last 5 years, which is the deployment of electronic medical records, because we think that that's been pretty much pervasive across our industry. So let's talk about some of the other things that are starting to emerge. One is workflow improvements. And historically, use of alerts, notifications, messaging, and communication between staff in large part has been on pencil and paper, or walking out to hallways to use kiosks, or even walking back to nurses' stations where that communication would happen and be more or less a central gathering point for nurses to communicate and share information. And those trends are largely, we're largely moving past that as an industry. Even the presence of nurse stations in facilities are starting to go away, and nurses are starting to spend more and more of their time just out where they need to be with residents providing care. And so how do nurses or maintenance men communicate in those worlds? Well, it's through the use of smart devices. It's through mobile applications on mobile phones. And what we're really seeing is a move away from kiosks out in the hall, away from paper documentation, and away from the old style of pagers or even two-way radios, and really a pretty widespread adoption or a rapid adoption, I should say, of smartphones, whether that's iPhones or Android devices, where one single device can run multiple applications and really inform a caregiver, for example. They can do their electronic documentation and be running point-of-care software right on that device. They can take resident vitals and do electronic documentation right away in the room at that resident's bedside, or maintenance staff that can receive notification or real-time alerts about something happening in another part of the facility, a window that's broken, or a piece of air conditioning equipment that's stopped working, that can show up as a task for them to take care of and put in their queue for the day. And all of those are things that were impossible really with old-style technology, whether it's pencil and paper or even a pager that builds up a queue, and then you still have to take that queue of information and transfer that to a to-do list for yourself. All that can now be managed instantly on your phone. And we're seeing that also with nurse call systems and other types of alerting systems, wander monitoring and elsewise, that can, for nurses, start to build up a to-do list of things that need to be taken care of during the day. Also in that list, in workflow improvements and flowing into the next one in mass communication, things like secure texting are really allowing clinicians and doctors to have conversations that include protected health information in a secure fashion, and do so in a way that really allows them to quickly communicate and get a hold of each other without needing to wait to see somebody or get back to some place where they can make phone call. From the mass communication side, this is really an interesting trend around, and we've got a stat on here around digital signage in increasing employee engagement. And we, in conversation with one activity director, learned that she's spending about 30 hours a month compiling a calendar of activities that were going to be happening throughout the community, and then getting that pushed out to the necessary places where it needs to be. Well, today, through technology, you can keep track of all that information in one spot, just like you would your own Microsoft Outlook calendar, and schedule recurring events or one-time events. And all of that information can instantly and in real time be pushed out to your community's website, can be pushed out to social media, it can be pushed to residents' televisions in their room, it can be pushed to apps or emails or notifications to family members if you want to get them engaged with what's happening at your community. And so we're seeing this be a real significant time savings for folks at the community and your staff, but also a way to really boost employee engagement, quality of life, and also engagement of family members who you want to be coming and participating in activities at your facility. Next, let's talk about resident engagement. And there's a number of types of technology here and ways that technology is being used to engage seniors, whether it is through things like brain games and brain fitness, or whether it is through classes that are being conducted at senior living facilities. Sometimes it's by college students, sometimes it's by full-time staff members, and sometimes it's by outsourced staff that are paid to come in and teach seniors how to use the computer, or to watch videos online, or use social media, or even to engage in brain games and things that track your progress over time on memorization or responsiveness. And there's one really innovative initiative that was conducted with a small study called the Birdsong Initiative, and they had some really remarkable results. The folks that participated in that study, and albeit it was a small study, but were really remarkable, seeing a reduction of total doses of antipsychotic medications for 40% of the people that participated in the study. Behavioral episodes became less frequent for 54% of people that participated, and depression levels reported decreased about 41%. And so, well, we're just at the outset of being able to study and see sort of the measurable results of utilizing these types of technologies. It's so far been pretty impressive. And I think it's worth noting also that these results are not here just because of engagement with technology. There's certainly engagement with staff and others, like I said, around the during the education process, but it's the activity of ongoing learning and a whole host of other things that we've yet to study that are likely driving these results. And the last is around resident fitness. I talked a little bit about brain games, but there's also rehab and fitness equipment that is starting to incorporate technology in a really significant way. And this also almost can start to look like your rehab room. In some ways can start to look like a video arcade, where seniors and residents can go for a ride on a bike and be taking a ride through a virtual reality world. And their performance, their time, the amount of energy that they've expended, their reaction time to things that pop out at them during this ride can all be tracked. And it can be tracked over time to see whether they are increasing in their physical health and reaction times, or whether they're staying the same, or whether there's some additional interventions that need to take place. And so the use of this is not so much like a video game where you would see it, you play it once and it's just for the pure enjoyment in the moment, but actually the intelligence built into the software that can track and monitor health and wellness performance over time. The next trend that we want to talk about is is actually a couple things that we're bucketing into what we're just calling emerging technologies. So what is the state of investment in senior living technology and healthcare technology? Well, it's been really significant over the last couple of years, and this is a study from a few years ago. But the principle here is that essentially over the last 5 years, what we've seen is a doubling. It was a projected doubling of investment in healthcare technologies, and senior living is no exception. As we are seeing a lot of firms come into the space, make really significant investments in sometimes what have been core technologies to our industry for years, and sometimes what are really cutting-edge, brand new technologies that have the potential to change our space. But as what's pointed out on here, that's close to just shy of $6.5 billion worth of investment in healthcare technology. Now, why are companies investing in this technology? As we look at the next slide here, you can see one of the big reasons is around workflow optimization. We talked about this a little bit earlier. There is high demand for caregivers. There's also, as we know, high demand for maintenance staff. And turnover has certainly been a concern in our industry for a long time. Today, studies show that on average, any given year is about a 10% shortage in nurses across this country. And what we see is that is only going to grow over time. And more than half of the need for nurses over the next coming years are going to be in the senior living industry. And turnover on the clinical side, studies have shown is around 46%, and we've seen it be even higher than that on the maintenance staff, sometimes closing in some studies around 100% or more. So what this shakes up to is a lot of investment in senior living and a lot of need for technology in senior living for workflow optimization. And certainly when you can give technology to your staff members to help them do more with less, what it's also going to enable them to do is to spend their time doing the kind of work that you want them doing and the kind of work that is most fulfilling for them. The most fulfilling kind of work and the work we want our clinical staff doing is caring for our seniors and our residents. And the most kind of important work that we want our maintenance facility staff doing is the kind of work that keeps the environment one that our staff and residents want to live in, and does so in a way that keeps costs down. And so if we can utilize technology to augment and automate the kind of work that's repetitive or task-oriented and doesn't fit into those primary buckets, then that's a win for everyone involved. So the next slide, let's start to dive into some of these trends, more specifically around emerging technologies. The first one we're going to talk about is Internet of Things. For those who are not as familiar with this, Internet of Things is essentially embedding connectivity, it's embedding technology and intelligence into what are otherwise ordinary pieces of equipment. One example that most people have heard of is the Nest thermostat, or the connected thermostat. So prior to this technology coming out, all of us in our homes would have a thermostat, and you want to change the temperature, you walk up to the wall and you turn it up a couple degrees or turn it down a couple degrees, and before you go on vacation, you probably set it for where you want it to be. Well, that works all well and good in a lot of cases, but let's say that you have a home that maybe you don't go to very often, and you want to monitor what temperature it is in your house and change that remotely. Or maybe energy prices are really high and you want your temperature in your home to be able to drop down a little bit during the day or night and then turn on when it becomes morning time. And or when you start getting closer to your house, 15 minutes ahead of time, you want things to warm up a little bit. Or another application of this might be that you want to heat your home or cool your house only when the cost of energy is at its lowest. And while that, you may see some savings on that as, in your house or apartment or condominium, for large building applications, savings can be extremely significant when you are using energy at its cheapest times, the cheapest times to purchase it. So what you're able to see there is otherwise what was simply a little control device in a thermostat now becomes a tool that can allow you to save time, save costs, and improve convenience in your life. And so where is this really taking place in senior living? Well, we're seeing investment and innovation coming out in a few areas. And I'm going to talk through each of these here. The first would certainly be around vital sign monitors and connectivity there. And what we're seeing is a desire for our industry to move past the time when a caregiver would walk into a resident room and take vitals and write that down on a piece of paper, and then either go out into the hall and enter that into a kiosk or back to a nurse's station and enter it there maybe at the end of their shift. It certainly takes more time, it's a bit more labor intensive, and it's certainly subject and prone to errors. What we're seeing is technology come out where you can actually go into a resident room with a vital sign monitor, take that resident's vitals right there, and immediately that information can be sent to the electronic medical record. There's no transcription, no possibility for manual written errors, and no need to wait, minutes or hours or till the end of the shift to enter that information. So your nursing staff or director of nursing can see real time what's happening with your residents and provide clinical interventions when they're needed. And that same thing is available in scales today, where a resident can be weighed on a wheelchair scale or standalone scale, and that information can be passed through directly into that a resident's record. Bladder scanners are also coming out with this technology, and we see much more innovation on the horizon in that area. Now, two other areas where we're seeing Internet of Things enabled products is certainly one around sensors embedded in the facility. This might be motion sensors, it might be fall pads and sensors, and what we're starting to see is a trend towards passive sensors that sit in the community and can start to monitor and predict resident behavior. Think about systems that are available today where you can start to determine through a pad that's underneath the mattress a resident's restlessness. These pads can actually today monitor a resident's heart rate and breathing rate. They're that sensitive. And you can start to predict that when a resident's sleep pattern starts to change, when their heart rate or breathing rate starts to change, that resident is about to get up in the middle of the night. And if they're a fall risk, that's an alert that can go off to have a caregiver come in for early intervention and make sure that we're providing that resident with some assistive care so that they don't fall in the middle of the night. Also, through sensors, being able to monitor residents' gait throughout the facility and how they're walking and moving to be able to predict falls, and once again provide the right type of care to prevent a resident from falling in the first place. Now, another technology that we think has the ability to really dramatically change a lot of the way that our facilities function in terms of calling for help is through voice-activated technology. And everyone's familiar with things like Siri and Alexa. But think about today, all the ways that a resident is able to call for help, whether through their nurse call system, or it's through just raising their voice and yelling and hoping that someone calls for help. And or especially with memory care residents, that they have to almost in some way remember how they need to call for help. Well, through these passive sensors and through voice activation, there is the potential that we can watch residents' behavior and interpret their activities, as well as listen for when they call for help, and immediately turn that into action for caregivers. No longer a need to remember to push a call button or pull a pull cord, but to simply call out, help, I've fallen down, or could someone please bring me a glass of water, or is my family here yet to visit me? Whatever those things may be, hey, I'd like to go participate in bingo, and that can be immediately translated to a caregiver to come maybe grab a wheelchair and take that resident down to the activity that they want to participate in. A lot of the certainly activity of nurses and even maintenance staff today is in triaging or trying to determine, do we have the right type of equipment with us, and have we sent the right kind of person to that resident room to provide the care right away when they need it. And the last thing I just want to say on that is again a move of the kind of consumerization of technology into senior living. Our seniors and our residents are going to expect that when they have a need, that the right type of care and services are available to them when they need it. The last thing that we want to talk about here is one thing that's really important to think about is that these pieces of technology do not exist within closed systems. It's very difficult to have a piece of technology that only integrates with itself. There's a big move towards open platforms and real-time integration with other systems, and there's an entire ecosystem of technology that is being created here. And so you may have selected, XYZ electronic medical record system, and so certainly one question as you're looking at these technologies is you need to ask, are the equipment manufacturers, do they have an open platform philosophy? Are they open to integrating with other systems? Have they integrated with your electronic medical record before? So that's just a little primer on what we're seeing in terms of some of the emerging technologies and some of the things starting to become available today in senior living. Next, let's talk about this specifically from a building management perspective. We just spent quite a bit of time talking about on the clinical side. Well, on the building management side, we're seeing connectivity available on large building management equipment like rooftop air conditioning units or even in-room PTACs. We're seeing kitchen equipment, walk-in coolers and refrigerators have real-time internet-enabled technology, temperature, lighting, even beds. And what do we see as the application of this? Well, certainly, if you have to wait for someone to complain about the temperature in a building, or if you have to wait until your staff arrives in the morning to realize that your walk-in cooler stopped working at 2 a.m. and all of the food has gone to waste, that's too late. What we want to see is have the equipment actually tell us when there's a problem. If there's a problem with your walk-in cooler, it can now alert your maintenance staff at 2 a.m. and say that, I'm starting to rise, temperature inside is starting to rise, and someone should really come take a look. The same thing is true of rooftop air conditioning units. It takes hours sometimes for maintenance staff to go up on the roof, diagnose, take apart, and start to figure out what might be going wrong. Well, imagine technology, which is available today, being available at your facility, that if there's a problem with a rooftop air conditioning unit, the unit itself can send your maintenance staff a message that says, hey, my filter needs to be changed, or fan has stopped working. Very specifically now, your maintenance staff will understand what the problem is, and they will know, is this something that they themselves can fix, or do they need to immediately call for service? We're seeing all sorts of products innovate in this space. These real-time alerts for your maintenance staff also have the ability to help you move more into a predictive and preventive maintenance sort of space that actually can extend the life of your community. And from a capital budgeting perspective, that's extremely important if you can certainly squeak another year or two out of a piece of equipment. And the last is, especially for scenarios, again, where staffing is at a premium, oftentimes we see facilities that have shared maintenance staff across multiple facilities, or a regional maintenance director that might be responsible for 12 different communities. And how are those individuals supposed to get everywhere they need to be within a couple-hour radius to care for those facilities? But it's not just caring for the buildings and the equipment, it's really caring for the residents and staff that are inside of there. So being able to set up rules and say, if something were to happen Saturday night at midnight with this air conditioning unit, I immediately want service to be dispatched and get somebody out there in 2 hours. Those are all things that are possible today, and these are what we are seeing emerge and start to take place in senior living. The next trend that we will talk about is artificial intelligence. Well, what is artificial intelligence, first off, for anyone who might not be familiar? Artificial intelligence is really the development of computer technology and computer systems that can perform tasks and do work that were previously only available for humans to do. And these are things like visual perception. These are things like learning and getting better at performing tasks over time, speech recognition, decision-making, problem solving, those types of functions. And what we are seeing is through the availability of an Internet of Things enabled products that we talked about before, and the intelligence that is being put into health sensors, an unprecedented level of healthcare data and information that's available to us today. Well, just imagine what is going to be available to us with the billions and billions of healthcare data points that are available to us around what is happening to us, to our seniors, and to residents in senior living facilities. Well, what this is starting to enable is learning algorithms and predictive algorithms that can help pieces of equipment and embedded sensors in our facilities actually predict healthcare diagnoses and notify you or notify residents or their care staff on what types of healthcare interventions are needed. And so what we have at the left here is a nice depiction of this, and this was from some articles that have been published recently about a patent that Google had applied for, that essentially is a mirror that could be used in anyone's home that has optical sensors built into it that can actually detect what's happening in your body down to the capillary level and actually start to detect things like heart disease. Now imagine that those sensors are interpreting that data, it's being sent back to the cloud and to their learning algorithms that are actually getting smarter and getting better at predicting these healthcare states every single day, every single minute. The more data that you feed them, the smarter they get and the more accurate they get at predicting these different healthcare states. So there's, in these senses, no need to even think that, hey, maybe I have heart disease and I'm going to go see a doctor, but that there are pieces of equipment that can actually start to intervene for you. Now, we are not saying that you shouldn't go see a doctor and you shouldn't still have those things, but this is what's possible in terms of technology being able to help us and become more aware earlier of changes in our states of healthcare. And these types of technologies being available in senior living certainly allow for the notification of caregivers to provide improved levels of care and intervene earlier than what has ever been possible. And the last trend we'll talk a little bit about is telemedicine. Telemedicine is essentially the remote diagnosis and treatment of patients via telecommunications technologies. So what we have left here is a nice picture of a doctor who is having a teleconference with a patient and at the same time looking at some of their scans, looking at their past medical information, and being able to provide care remotely. Now, this type of technology has been around for many years in areas such as radiology, where you can go maybe to a rural hospital in the middle of the night and get an X-ray or an MRI, and there might be a doctor on the other side of the globe who's actually interpreting those results. And what we are seeing is just a growing use of this technology, certainly in rural senior living facilities, but across health systems. By the end of this year, it's predicted that 96% of health systems will in some way, shape, or form use telehealth technologies. We certainly see this, like I said, impacting any senior living facility that's out in a rural area that may not have easy access to the broad set of physicians that you need to connect with, but also facilities that want to provide an improved level of care or services or expand their level of care or services outside of what they do today.
So let's summarize what we've talked about here today, and then we'll open up for some questions. First of all, we talked about the current state of technology that's deployed in senior livings, and a recommended next step we might have for you is to take a look at your technology investment plan. And are you prepared? Are you prepared for the current state where people are today, or are you prepared for the trends that we just talked about? You know, what is your mindset? What is your appetite for that type of technology? And what is your plan for getting there? So taking a look at where you are today and evaluating that might be a good next step for some of you to take a look at what's real and what's tangible today. We also talked about how to plan for, tailor, and select as well as implement new technology systems. And there too, excuse me, would be an assessment. Begin assessing where things are at. Begin assessing technology and the teams that you have and what they can bring to the table in terms of helping you understand the technology. You know, what are the complaints, what are the challenges, what are the areas of need or areas for growth, and how can technology help or improve those teams. Also taking a look at Leading Age Cast and the website there. Leading Age has done a great job putting together resources to help people plan for and look at technology as well as trends, and that would be a great place to start if that might be a place where you were at. Third, we talked about senior living technology trends and really looking at what trends, next step might be looking at what trends would be good for you to consider. You know, which ones might be the most impactful, which ones do you want to plan for in the near future, and where do you need to get to, not only from a technology side, but also taking a look at what is your staff comfortable with, and how can you make them successful when you do decide to roll out some of these new technology that's coming out. And last, we talked about the future of technology, so some of the Internet of Things, artificial intelligence, and smart buildings. You know, you can start taking a look at who are the partners out there, who is understanding what this technology is, and how would it be thoughtfully and meaningfully deployed in your communities. You know, who are those companies, those organizations that understand that and can partner with you to help explain and help everyone plan for what will be and what can be in the future of technology.
All right. Thank you, James and John, for that great information. We have time for a few questions. So the first one is, what's a good resource for finding the specific technologies and companies that you're referring to here? There's thousands of companies out there, but discovering reputable companies with senior living tested technologies that fit our needs is challenging.
Yeah, there are a lot of different resources, and one that we really like and have talked to a lot is Leading Age. They've put a lot of time and resource into technology and what it means for senior living communities. So they'd be a great resource. They've published a lot of different articles and how-to documents as well as guides. So I'd say start there. They also do link out to other sites, white papers, those types of things. We've been able to work with them to provide some information as well. And they do a great job of polling not only providers but also technology manufacturers to get those answers and make that available to the masses. So that'd be a good starting point.
Great, thanks. There was also a question asking to repeat the name of the resident engagement study that you referenced.
Oh, that is called the Birdsong Initiative. And speaking of Leading Age Cast, there's actually a case study or white paper that was written up by them. If you go out to their website, you can find it out there.
Is there any contact at Direct Supply that could help guide us if we're looking for specific technologies or solutions? It feels like a plant question, but it's not, I promise. It does lead well into our next section.
Yes, we are going to be talking about some of the resources here available at Direct Supply to help you with that. And that would now be okay.
Well, we have one more question. Okay. I think we'll jump into that right after that. So
we'll get that addressed in real quick.
Yes. So can we expand our Stanley aerial nurse call system to do more monitoring of patient vitals?
That would be a good question. It depends on what the Stanley system is doing for you today and what you mean by wanting to expand that in terms of vitals. So what vitals would be important for you? We're familiar with Stanley. They're a very solid company, and it would be one that you could take back to them to see what options and offerings are available. But I think defining what it is that you would actually want to get out of those types of sensors is going to be critical for them to be able to pair that with the need that you have and seeing if they have anything available. If not, there may be some other alternatives through other technologies or things that may be able to integrate in to that solution. So I'd say worth more conversation with that specific provider. And for those that might maybe have the same type of question, but other providers as well, asking them or other partners that you might work with in the tech space, how they can help achieve those goals for you.
All right, and one more, I guess I have a popular topic. Is there a way to get involved with product testing, something to offset the cost? Speaking of the touchscreen technology for brain health and dementia care.
Yes. In fact, a lot of times manufacturers and companies, we certainly do this, and I know a lot of companies do. If you're willing to be an early adopter, if you're willing to provide feedback and case studies, a lot of companies will oftentimes offer discounts or work with you on the pricing there because it's really a collaborative effort. So I would say whatever technology you're looking at and a company that you're talking to, I would certainly bring that up, as that's usually of high interest to startup and technology firms.
And now for anyone interested in learning about the technology solutions that Direct Supply offers, please join me in welcoming back James Jansen.
Great, thank you. So we are going to bring up some of those solutions here that we can talk through specifically to the question and partnership. Direct Supply does have a couple of different offerings that are available to you guys. So first would be a technology design offering, and I'll get into that in a little bit more depth, but that's really specific to new construction. We do offer programs like Tech Track, where we're able to help communities audit buildings that they have, especially if you're going through acquisition, or if you just need better insight into what's going on in your community. That is an offering we have, so we can help with audits, help you put together standards in terms of how you need to operate technology, as well as help with capital planning and investment. So understanding life cycles of the technology that's in your building and being more purposeful and planful with that technology and how you can plan for that over time is going to be important. So that's what that program is about. We also do sell technology systems here at Direct Supply. So if you do need nurse call, wander management, video surveillance, access control types of systems, we have those available today, and we take a process, a planned approach to that with you, again, bringing in that cross-functional team to identify what is the right solution, or what's the right fit for you. We'll design everything for you. So that it's done thoughtfully and in a way that can reduce expense, maybe leverage existing technology spend. We will run all implementation for you with our own installation team, so you don't have to worry about the systems going in place. We've done hundreds and thousands of systems over the years, and we'll lead you to success there and would partner with you there on the implementation side. And then on the support side, we do have our teams here, as well as manufacturer support for the ongoing questions, support needs that might be there, as well as online ordering through Direct Supply's multiple platforms. And if you don't need systems, you have systems in place, you just need a spot for parts for systems or service for systems, we can do that as well. So there's DSSI and DSN and a few other online ordering channels, as well as account managers. They all have access to the various parts that we have for nurse call, wander management, access control type systems. So you feel free to take advantage of that offering as well. But any way that you need help with technology or access to technology, we're going to have that for you. What I will dive into on the technology design side is a new offering that we came out with about 2 years ago, and really at the request of our customers and clients to help with new construction projects. What they were finding is they were falling behind plan. Buildings were not opening on time. The technology plan was not integrated, so there was a lot of overlap and misstep happening. So our technology design service is a feed service. And what we will do is have a technology designer, and they have 20 to 30 years experience amongst them individually, really putting together a comprehensive plan. So they will do all of the network cabling diagrams and infrastructure. They will lay out your Wi-Fi. They will design your nurse call systems, wander systems, video surveillance systems. There's about 9 different buckets of technology with which they can design. And it all comes together in one elegant plan and format that not only the manufacturers and installers that you would have for each system can follow, but also general contractors and electrical contractors as well, because they're all going to play a role in that equation of your buildings opening on time. And our technology design offering is meant to make that a seamless and streamlined process to reduce change orders and to help buildings open on time. That is vertically integrated with everything that we do here at Direct Supply. So any systems or a majority of the systems that you're seeing your tech designer put into play are also ones that you can purchase and have installed through Direct Supply as well. So we can help there to streamline the entire new construction process for you. Next up, we wanted to highlight on the safety and security side a partnership we have with a company called Hikvision. Hikvision is the world's largest manufacturer of end-to-end security solutions. They are manufacturing about 250,000 video cameras a day. So they are by far the world's leader in terms of size and research and development going into this space. And what they have is an integrated 3-in-1 platform where you can combine your video surveillance, so your cameras, your access control, so your badge and your fob type solution, as well as your intercom station. So the, buzz me in at the front door because it's after hours and I forgot my badge. That whole platform resides in one simple software solution today. They have access to quite a bit of research engineers, and their product development is moving quickly, and they're always innovating, and they're always looking for ways to improve. And through partnership with Direct Supply, have really put a senior living focus to what they're doing, and they're trying to build out smarter, deeper learning technology that can help address some of the challenges that exist today in senior living. So their 3-in-1 solution is very nice. It's fully integrated and very seamless. They are the industry leader in what they do. Excuse me. And to John's earlier point about mobility, you are able to access the system because it's network-based from anywhere. So if you have a tablet, if you have an app on your phone, you're able to access and control and manage the system right there, which really puts the power of that technology right in your hand. The next thing we wanted to highlight for you today would be our connected clinical platform. And really what this is a seamlessly integrated platform where we are taking the connected equipment that John had talked about earlier and feeding that information into EMR system. Today, a partnership exists with Point Click Care. And the first thing that we really tackled was the vital signs monitor. So today there's a connected vital signs monitor where that information John spoke about a little bit earlier can flow right into your PCC interface. That is available today, and what we're really excited about is the time savings and the efficiency that brings to your clinical staff. So, waiting to the end of shift or having to go to a kiosk or walk down a hall to enter charting not only takes time, but there's transfer errors, transcription errors there, and this gets around those entire challenges. So this is a newer product available through Direct Supply, and we're very excited for this to be the first platform that we have that's in our connected clinical portfolio. The scales and the bladder scanner are soon on its heels. They are coming soon and under development as we look at what type of clinical equipment do we need to make connected and do we need to get into the cloud so it can feed to EMR. So we are rapidly building that out. And if you have questions, concerns there, John's able to answer those for you, or Brad Johansson as well is a product expert in this area and would be glad to answer those questions. And finally, we wanted to highlight OnCall. OnCall is a partner of Direct Supply, and we love the work that they do and the thought process they bring to technology. So what OnCall is a connected in-room portal, essentially, where you can connect in clinical data from scales, pulse ox, blood pressure, even a mobile pendant, and other devices, and it all feeds into the OnCall box. And from there, you're able to take a look at all the readings measurables online, whether that's community, whether that's family, whether that might be doctors or other people involved in the care equation for that resident. They now all have access to this information. So the sensors that are Bluetooth or Zigbee or Wi-Fi connected, OnCall speaks many technology languages. Those devices can connect into OnCall, and people can take a look at what's going on the back end. So a very powerful tool. There's also medication reminders. So if medication schedules do get put into the OnCall software, it can push that out to residents, reminding them to take medication. And then any kind of emergencies, a pendant or a call for help, those types of things can also run through your OnCall system. So it's a single connected box, but it does quite a bit, and we're very excited about the partnership there with OnCall. Again, to learn more, I'm glad to help. John is also glad to help, and Brad Johansson and Renee Rydzewski are our product managers and product consultants for that area too.
Got some exciting stuff going on.
There's a lot out there. More to come.
All right. And we have a few questions about the products themselves, as well as one that kind of goes back to the presentation. So first of all, is Hike Vision part of March Networks?
Yeah, good question. I'll have to get back to you on that. Hike Vision works with a lot of distributors and partners around the world. They literally have hundreds of integrations with different technology systems. So we can take a look at who that is, but they are available as well through Direct Supply.
All right. And then there's two on the building management and TELS side. So the first question is, can TELS be expanded or integrated into assisted living services?
Yes. So it's certainly today on our TELS platform, there certainly is the ability to deploy some of the services that we talked about in the presentation, things like service for rooftop air conditioning units or kitchen equipment or plumbing services, things along those lines. So right on the TELS application mobile app, you can call for and dispatch service. And certainly something that's on our roadmap and that we have demoed and piloted and have some technology bid for is the ability for these products, these connected products, to integrate directly into the TELS platform. And TELS today does have a number of integrations with other systems like EMR systems where clinical staff can submit a work order that is automatically integrated with and opens up a work order request in the TELS system.
One thing I would add to both the TELS question as well as the clinical is Direct Supply does a couple of different forums here. We actually have a lot of events here at Direct Supply, and every May we have the TELS Summit. The TELS Summit goes on every May, and that's where ideas like what John just spoke about and what is the next generation iteration of what TELS is, a lot of it comes out of that conference where we can share ideas of how that platform is developing. As well as get feedback and insight from you guys as well as how to improve that product. So if you've not come to the TELS Summit, it's a great event, something you could look into doing. We also do that on the clinical side. We do that every July, and that's a newer event, but we've had lots of head clinicians and clinical teams come in, not only to share ideas, thoughts, and how can everyone help deliver better care and really have a great ideation and brainstorm type of session, but also looking at some of the technologies we have here. There's a host of others that we're looking at that are at various parts in their life cycle. Some of them are brand new, and we bring those technologies in, let you see them, let you talk to the CEOs or the developers for them to get feedback on how to perfect their technology. and see what Direct Supply is doing. And that's a great session as well for this type of tech. So if either of those conferences or events would be good for you to join, we love having people here. It's a great time to really dive into this a bit deeper, and we would extend that invite to you.
Absolutely. One last question, I think, and this is relating to the EMRs you just mentioned. Can OnCall interface with EMR bidirectionally?
Ooh, that's a good question. I have to check into that one, and if we capture Robin, who asked that question, we can get back to you and let you know. But certainly there is a number of active integrations that are underway and being brought up for OnCall currently.
All right. Wonderful. Well, thank you both again, and thank you all for watching today. If you do have any further questions about the products discussed or the content, please reach out to James or John or send us a message at our Direct Supply webinars. And for more information about upcoming webinars or to view past webinar videos, please visit directsupply.com/webinars. Once again, thank you for attending today.